Welcome back. For many years, I and many other healthcare professionals have been preaching the benefits of finding the cause of someone's health issues. Cardiovascular disease, acid reflux, fatigue, you name it. Practitioners of functional medicine are always looking for the why and the where. Why is someone sick, and where's the disease coming from? So today I want to introduce you to a wonderful dentist and friend of mine, Dr. Tom Hedge. Dr. Tom Hedge has been in practice for more than 25 years with an emphasis on the TMJ. But today we're going to pick his brain on what happens in your mouth and how it might relate to cardiovascular disease. Welcome, Tom.
Thank you. Good to be here.
You're a dentist, and functional medicine and dentistry, that's kind of an odd pairing. Tell me how you got interested in it and what dentists or what you do as it relates to functional medicine.
Well, primarily my wife and myself practice together, Dr. Frazier, and we have a large family practice. I mean, our big thing is we take care of a lot of people with a lot of different needs and desires to stay healthy. Mm-hmm. And personally, I ran across some cardiovascular issues myself. When it affects your own person, it gives you a particular emphasis on...
Different perspective, isn't it?
Yes, absolutely. So recent research has shown that, obviously that inflammation is a horrible thing in the body. Any part of our body that gets inflamed is a bad thing.
It's a killer.
Especially our cardiovascular disease.
Right.
So
Tom brought a graphic. If we can put this first one up, I want him to kind of explain this graphic as it relates to dentistry and cardiovascular disease. So go ahead and show him what we're talking about.
I want to throw out a statement that
Sure.
just came out in a recent study.
Yeah.
1 out of 2 heart attacks are caused by dental bacteria.
That is just, when he was telling me that earlier today before we were doing the show, that blows me away. 50% caused by dental bacteria. So here's a graphic.
Here's how they found that out.
Yeah.
They actually sucked the clot out of a heart attack victim.
Someone
Essentially
who
a heart
passed away.
attack is when there's a clot that breaks away. It's
Right.
going through the bloodstream, and it finds smaller and smaller and smaller vessels. Unfortunately, those vessels are in the heart and they're in the brain.
Right.
If they lodge in the brain, you have a stroke.
Right.
If they lodge in the heart, you have a heart attack.
Mm-hmm.
So they sucked those clots out of the heart attack victims and cultured them.
Right.
And found that half of them had bacteria that came from the mouth.
Came from the mouth.
So how'd that happen?
Let's look.
So this is a tooth right here. You can see the top of the tooth, and this is the gum tissue. And when we go to the dentist, we may have had our gums probed where they measure the pocket depth, where they'll go down in that pocket accumulates bacteria. And when our gums bleed, and a lot of people think, well, my gums have always bled, it's normal. Well, it's not normal. If the amount of inflammation and bleeding in your gums was put out in one space, it would be the size of a Post-it note.
So let me make sure I understand. If you have bleeding, whether it's through brushing or through flossing, you probably have inflammation there?
Yes.
Okay, so go ahead.
75% of the adult population has gum disease.
Okay.
Age 55 and older, moderate to severe gum disease is 90%.
So 90% of our viewers have gum disease if they're over 55 years old.
And who are the people that are sick, that have inflammatory disease that affect their pulmonary system, their
Right.
cardiovascular system, right?
It's over 55.
So
Right.
that's it. So what goes on here, these bleeding gums are now an open portal or open access to your cardiovascular system. So there's
Now explain that. So we go from the tooth, and
so-
how do they get to the cardiovascular
So these
system?
bacterium plaque right here, there's
Right.
700 kinds of bacteria in your mouth.
Okay, 700.
8 of them are really bad from a standpoint of inflammation and gum disease.
And we're going to get to another graph in a minute. So
One of them is bad to cause bacteria,
Okay.
to cause gum disease.
Right.
So these permeate into your blood vessels.
So we've got a bleeding gum, and they permeate. Go ahead.
To get in your bloodstream, they float around, and as we get older, our blood vessels have developed little cracks. And we've talked about this in the past, that cholesterol you're feeling is not really a bad thing. It's the body's natural patch to
Can be, that's right.
to cracks in the cardiovascular system. So these bad bacteria will embed in the arteries, causing inflammation, and as they work their way around on that graphic up there,
So this blue outline here is the artery,
right?
and this is the plaque that's built up from the bacteria.
Yeah, the bacteria will actually embed into the walls of your cardiovascular
And
system.
then that's when the cholesterol will stick to it and cause even a greater buildup of plaque.
Right.
So folks understand what we're talking about. Cardiovascular disease coming from your mouth, and Tom has just explained exactly why. So, yep, there's a baby down here. Explain that.
Well, this is a side effect that we don't often realize, that women often have bleeding gums when they're pregnant.
Okay.
It's a natural hormonal thing.
Okay.
Now that opens up the portal for all the bacteria in their mouth, and there are two particular bacteria that can cause early pregnancy and preeclampsia or early contractions.
Okay,
And both terrible things.
so should we go to the other graph now?
Yes.
Can we go to the other graph and let Tom explain these two?
So we can do genetic testing on bacteria, and it's so simple to do. What we do is we have you swish this in salt water, spit into this, we seal it up, and we send it off for analysis.
Okay.
That analysis comes back to us, and we're looking at mainly these 8 different, these are bad bugs. I mean, they cause...
And they're in many people's mouth.
Just about, yeah.
And if they're healthy, it's not that big of a deal.
Right.
But if they have that gum disease, as you were indicating earlier, that's when the problem occurs.
Mm-hmm.
So it looks here like, and I'm not going to be able to pronounce a lot
these
of these.
names are, we'll call it AA and PG.
Okay. So this one, if you have a lot of it in your mouth and you have gum disease, it affects the cardiovascular disease.
Right.
This one, the kidneys.
Correct.
Cardiovascular. Here's your preeclampsia you were talking about. Myocardial infarction. Now here's your respiration. Folks, if you think about the conditions that people have every day, the chronic conditions, heart disease, kidney, liver, and lungs, that's the majority of our diseases. And you're telling us, and this is research, this is not something that somebody's making up. Or
well, this is an analysis we do on probably about half of our patients in our practice.
The test
we
you were
send this
talking about.
test off, and we get this report back, and it gives us a little simple bar graph showing, do they have these bacteria? Do they have them in excess? And what do we need to do about it? And that'll allow us to use specific antibiotics or specific treatments that are designed to kill that particular bug.
So if it's over a certain amount,
Right.
if it's an abnormal, then you've got treatment protocols that you use. And again, this is for patients with diseased gums particularly. And
Which
now
is 75% of the people.
75% of the people, and 90% if they're over 55.
55.
So I don't know if any of you out there have dentists who have ever offered this, but this is a tremendous, it's such a valuable tool, especially if you're one of those people who really want to protect themselves from the chronic diseases, cardiovascular disease, liver disease, kidney, lung. This is something y'all, do a lot of your peers do something like this?
This is very new treatment modalities and analysis. I would suspect most dentists are not familiar with this as yet.
And do these people do it in your office, or do they take a kit home?
We just do it right in the hygiene room.
While you're right there.
Takes a minute.
Does the insurance cover it perchance?
They generally do.
So insurance covers it too. I
Yeah.
mean, it's like you can't lose with this thing.
So here's another interesting too.
Yeah.
We don't think about this. These top 2 bacteria right there,
Yeah.
oral bacteria that are very infectious, they're very transmissible. So in other words, if you get it cured and you get your gum disease under control, but your wife has it, you're going to get it back.
She's going to give it right back to you.
And your kids, and your fetus that we saw down there.
And if you've got young kids, then you're going to transfer it to them possibly.
Yeah.
That's something, I mean, folks, this is something that's really new even to me. I knew about the dentistry, but I didn't know about all of this to this depth. This is incredible. This is one of the reasons why I like talking to this doctor, because he's right there with a lot of others of like myself who are on the cutting edge of doing things to help you stay more healthy. So tell people where your practice is if they want to contact you.
We're in Bellaire,
Okay.
near the Galleria, and a lot of information on our website, thehoustondentist.com, with an S at the end. We've got all these charts and graphs are on there, all that information.
And you talk to people and explain these things, besides obviously doing normal dentistry work. This is an advanced thing that a lot of other dentists in this city or throughout the nation aren't doing yet, so you're right on the cutting edge.
We developed a total health protocol where we've got 20 diagnostics that are for various things that are like this, that we can really drill down to the root of the problem.
So if someone's going to the dentist and they may not even know they have cardiovascular disease, but it's setting up in their bodies years in advance, you can help them detect that.
Absolutely. If I had a heart attack, stroke, or had any history of cardiovascular disease, I sure as heck would have my gums checked.
Folks, I hope you enjoyed this segment. To me, it's been extremely enlightening. That ends this segment of the program. Next, we're going to go to Ask the Doctor. This is where you, the viewing audience, can ask me questions. So let's take one last break and we'll be right back.
It's not his new group of friends. It's not the video games. It's not the neighborhood.
Mom, do I have to go to school today?
The biggest threat to your child's future could be you. Every day they miss, even in middle school, puts their graduation at risk.
Welcome back. As I stated in the opening of this show, I received a whole lot of calls relating to chronic pain issues, and generally I tell about one of those calls. But unfortunately today I need to tell you about something else that I just found out about a few days ago. Any regular viewer will remember a show we did not long ago that tried to explain how the Texas Medical Association and the American Medical Association had sued the state of Texas, trying to take away the ability of chiropractors like me from diagnosing and treating patients. Well, if you remember, the Texas Supreme Court ruled the chiropractors could continue to diagnose, but that the state legislation needs to address this in their next legislative session. Well, a few days ago, the TMA and the AMA filed another suit using a different angle, but the same intent. The TMA and the AMA is trying to stop us from treating you, the patient. So as I've asked before, and I'm going to beg my viewers again, please contact your Texas State Senator and your House of Representative and ask them to look into this and tell them that you want to be able to choose the health care provider that you want to see and not be forced by the TMA or the AMA to be limited to only seeing the doctors that they want you to see. Well, this ends this episode of Better Health. I hope you have enjoyed the show. It is my desire to help educate individuals about a variety of conditions and treatment options that exist outside of conventional medicine. I should also state that I am in no way making any type of diagnosis for any condition. All of the comments on the show are for informational purposes only. Any condition that you have or you think you might have should be discussed with a qualified healthcare professional. Again, I encourage you to send me any questions you might have regarding today's topic or any other health-related topic, and just send it to an email, hcctv@hccs.edu. And as time permits, I'll answer your questions on air. Until our next show, take care, enjoy life, and live healthy.